The things you enjoy most, I'll make sure you don't enjoy them anymore. The people you love most, I'll make sure to push them away from you. Were you motivated about life, work, school, love? I'll be sure you'd rather stay in bed all day. I'll make you feel worthless, hopeless, and sad. I am depression, and I'll make your life miserable. I'm going to inform you on 3 aspects of depression. 3 aspects include its symptoms, causes, and treatment options. Depression is a common but serious illness. According to the Healthline Depression Facts and Statistics, depression is a condition that reportedly affects 1 in 10 Americans at one point or another. Depression is an illness in which a person feels discouraged, sad, hopeless, unmotivated, or disinterested in life in general. The symptoms of somebody who is depressed vary differently between every person. Symptoms include persistent sad, anxious, empty feelings, pessimism, worthlessness, helplessness, and guilt. Symptoms come together to produce feelings of uselessness and that things will never be okay. Other examples include decreased energy, overeating, appetite loss, and changes in sleep. During depression, people may lose interest in their usual activities and lose capacity to experience pleasure. Activities may seem boring or unrewarding that were once pleasing. The ability to feel or give love can be diminished or lost. The inability to concentrate or make decisions are also a troubling aspect. Severely depressed people may not be able to even follow a newspaper thread or stay concentrated on a 30-minute TV show. Major decision-making is also nearly impossible. Low self-esteem contributes to negative thoughts, including dwelling on memories of losses or failures and feeling excessive guilt and helplessness. These can lead to suicidal thoughts. Besides suicidal thoughts or suicide attempts, aches, pains, headaches, digestive problems can occur as well. These thoughts and feelings can occur daily and for no apparent reason. Depressive episodes may occur once or twice in a lifetime, or they may occur quite frequently. The good news is that depression is treatable, but before I talk about treatments, I'll tell you about the causes. There are a combination of different factors that can cause depression. According to the National Alliance on Mental Illness, a person's life experience, genetic inheritance, age, sex, brain chemistry imbalance, hormone changes, substance abuse, and other illness all play significant roles in the development of depression. Depression may occur spontaneously and be unassociated with any life crisis, physical illness, or other currently known risks. Depression tends to run in families, and it's thought that depression is a complex trait that may be inherited across generations. Biological factors also may include the structure of the brain parts, brain chemistry, and stress hormones. Past physical, sexual, or emotional abuse can also cause depression. Different aspects in life, including marital status, financial standings, and living situations, can also have an effect on depression, as well as a big move or a death of a loved one. Additional factors include history of sleep disturbances, medical illness, chronic pain, anxiety, attention deficit hyperactivity disorder or ADHD, and alcoholism or drug abuse. According to Healthline Depression Facts and Statistics, over 80% of the people who have symptoms of depression are not being treated for their depression. Once diagnosed, there are a variety of ways to treat depression and get a person's life back on track. Taking a medication prescribed by a doctor is one way to treat depression. Selective serotonin reuptake inhibitors act specifically on the neurotransmitter serotonin. These are the most common prescriptions prescribed worldwide. Psychotherapy is another treatment option. These are short-term therapy sessions that last about 10 to 20 weeks. There are 2 types of psychotherapy, one including cognitive behavioral therapy, which helps people restructure negative thoughts and patterns. Doing so helps people interpret their environment and interactions with other people in a positive and realistic way. Interpersonal therapy helps people understand and work through troubled relationships that may be causing their depression or making it worse. There are also brain stimulation techniques that include electroconvulsive therapy or shock therapy. It is actually a highly effective treatment for severe episodes of depression. It is recommended when all other depression treatments are not working. Before electroconvulsive therapy begins, a patient is put under brief anesthesia and given a muscle relaxant. They sleep through the treatment so they don't feel any electrical impulses at all, and these are normally done several times a week. I have now informed you on the main aspects of depression. Aspects include symptoms, causes, and treatment options. With successful treatment, depression can fade away, and people can go on to live happily without negative aspects holding them back.